Okay, so just I will make a very short presentation about who are SMA Europe, who are we, what we are doing, what is our aim, and after that I will more details our project and priority for the year 2022 and 2023, because we are working on not on calendar year, but more from September to June. So you will have a presentation about our action. So we are a quite old organization now. We are being founded in 2006 with many countries. And we are patient organization focusing on SMA, with some patients specialized on SMA and some other more neuromuscular organization over Europe. The delegates are all volunteer and representative from the member organization. And we are taking care in different things, mainly focus on treatment, research, but also sometimes on policy. Just to see you, now we have 23 country member of SMA Europe, and that means 44 delegate, and also we have 5 board member. As we grow up, we need to have a board member. And we are just what is not in this place, in this map, but just include Turkey as a new member. It was decided last week, so my map is not up to date, but Turkey is now a new member of SMA Europe. So what we do have a house, of course, is built on capacity building. And this is very important for us to empower all our members to be more effective and efficient, to be proactive in their own country. And it's very important to have this capacity building. And the house is built with 3 different pillars. The first one is research, and we will detail more what we thought about research. The second one is more on therapy and care, and it's very important because at this time we have many treatment available, and we need to continue to have very very good, best standard of care. And the third one is more focusing on policy and access to treatment and access to the best standard of care. So it's very important. We try to interact at international level, at EU level, for example, to improve healthcare system, but also to give a capacity to our members to interact at their own level, in a country level or regional level sometimes, to have access to this treatment. And what is also part of the building is our capacity to communicate, and we have a lot of effort put on this capacity of communication. So it's very important for us to have an improve in the diagnosis, but also an improve in the basic research. So you will see through our action plan how we can do and interact with all this culture. And of course, it's very important also to have the patient voice heard at each level. If it is to clinician, also to focus on research, to clearly input in research, saying this is the place that we need to have more additional research. It's very important to go there. How we do it? Of course, by empower our member organization to advocate and to campaign, but also we do a lot of work on influencing scientific, influencing healthcare system, pharma, regulatory. We have a very, very big impact in the design of clinical trial, especially in the design of the Roche trial, where we were part of the pilot and very impacting this. And it's very important for us to be able to interact with all the stakeholders at the beginning of the story, and not just when we keep the result and the results are not online with what we expect. So the idea is that together we can be more powerful, and it's very important, a better word to a patient living with SMA, within with spinal muscular atrophy. So I will more detail now about our priority for this year. We are on the way. So I show you the 3 different pillars, and of course the first one is research. And we are, through our member now, we have a current survey ongoing, trying to identify what are the 10 most important questions, unanswered questions regarding SMA, or where we need some more evidence to continue. Just to give you an example, for example, we need data effectiveness regarding the new treatment on adults, because it's very challenging to have reimbursement for adults. And if we have some data on this part of the population, it will be very important to have this. That's part of this, or we will have many questions. So we are going through all our members saying, please give us the 10 best questions you wish to ask to a scientific. The second point is just close, and the result will be published next week, is a call for research. We have an important call for research. Each 2 years, more than 60,000 euro was in the pot, and the pot is done as only by patient organization who put money in the pot to have a very large pot, and so we can have a small influence on what research we fund. Mainly is basic research, but it's very important to have this basic research. And for example, this year we have 24 answers for the call, and we perform to finance a 6 research program, and they will be announced next week. One, or maybe some of you have already participated, is our scientific meeting. Every 2 years we have a scientific meeting to bring together clinician, researcher, but also pharma industry and patient organization. And it was a very large meeting in Barcelona in October. And we are preparing the next one in Belgium. I think it will be in Ghent in 2024. So every 2 years. It's a very amazing meeting. Last meeting, we have more than 860 people, researchers, and more than 70% were scientific, clinician or researcher. So it's very important to put them together in the same place and to have this. And it's very, it will be very, very appreciated for this. And we have 2 more new activity with just starting. One is called Smart Horizon, and it's a research co-funded by SMA and SMA Europe to identify, co-funded by SMA Foundation in the US and SMA Europe, and it's to identify some research on other disease or completely out of the box, but never think that could be helpful for SMA, but thinking that it could be also a very important thing for SMA. It can be exoskeleton, it can be some treatment to change the forces, but it can be very, very different way of treatment. So we have launched this call for research. just at the beginning. It will ongoing next year. So it's very important to have in mind that sometimes another disease or a treatment for a chronic disease can be useful for SMA, and how we can make evidence that it's useful for SMA patient and you can use it for you. And this last part, it's a working group that we have to take part in scientific publication and all the research going to SMA. We have some patients who go through this working group and they support the research or they change the research and they can give the input. So as you see in the research, we try to have an impact at the beginning, but also at the end to disseminate all the information in the relevant population. What we have also, it's very important, is therapy and care, because it's more close to patient, but very important. So we have some study ongoing. The first one is a daily life study. It's very important to understand what is the psychological social context and what can have an impact on the capacity of SMA patient to do everyday life, or to have an impact to stop everyday life. So it includes some psychological impact, social impact, and very, very large variable. The study is ongoing at this time, and we expect to have some result by June, but it's just ongoing, and we are collecting data for more than 150 patients. So it's very large study. Maybe a lot of you have answered to our previous study, which was called a SMA, which is a pan-European survey regarding the access of physiotherapy and the difficulty of nutrition. We have more than 1,000 SMA patients who answer to this survey, and we are on the way. We have published the first part of the survey, and we are on the way to publish the full impact. And it was very, very interesting to see how we can have differences, but also common point, common difficulty, whatever you are in each country in Europe. We have also a working group working on disseminating the standard of care. It's very important. It's also focusing on physiotherapy and nutrition. Why we are so focused on physiotherapy and nutrition is because we discover that even if you take a treatment, you have to follow very good standard of care. And the two most important pillars outside of a new treatment is physiotherapy and nutrition. And even if you have no treatment, if you have a good physiotherapy follow-up and a good nutrition follow-up, you can avoid a lot of difficulty for SMA patients. So you see, we have different focus on physiotherapy and nutrition, because for our understanding, it will be the next very important point we have to put. And then we have the SMA treatment committee. At SMA Europe, we are in very close collaboration with pharma, and we have working group working with pharma with a regular meeting. And we have created this SMA treatment committee, where you have people participating to the working group with pharma, but also people connected with EMA. And we can have interaction with EMA and also to ask some questions. Of course, in this treatment committee, we are not focusing to one treatment, but to a common action. Can we avoid a placebo group? How to redesign a trial to be less impactful for the patient? If this is the sort of question, and also when we have an adverse event, to discuss how we can disseminate the information, how we can go to EMA to have a better follow-up regarding this adverse event. So each time we have 1 or 2 questions during this treatment committee, and we try to build together an answer and go outside then to disseminate our answer. And we have also the clinical trial readiness is more to identify and to train clinician and patient advocate to build our capacity. It will be done in close collaboration with all of this. And it's very important also to have this common training between clinician and patient so we can better interact together. We have also a few activity or some activity that are very, very important. We are building a new website called Odis SMA, where we have collected all the important information regarding the new medicine, all the data you need. The objective is clearly to have a follow-up where the patient can have an access, a full access, or a limited access to treatment, but also to better understand the difference between the different countries, to identify the priority, and so we can go to support in one country or in another one to support them to have access. And also to have all the information, all the evidence that you can put forward when you need to go to apply for a treatment on an access. And the second one, very important project, is the SMA Newborn Screening Alliance. We have created this alliance, is more or less a spin-off from SMA Europe to support all the European countries to have an access for newborn screening, for SMA newborn screening, with a very important objective to have all the baby born in Europe screened by 2025. It's quite a very ambitious objective, but to give you an idea, from now, we have more or less 45% of the EU child who are screened, and we have 40% of European child to be screened, including Turkey, who has a very large population and a newborn screening fully implemented in this country. So it's very important for us to have this. So the Newborn Screening Alliance can support national entity or at least regional entity. We have a small budget to support you to create awareness in your country and to support your action to apply for newborn screening if any country in Europe have a difficulty to access to newborn screening. But we also are in close contract with other countries. For example, we have a very close collaboration with Latin America and the similar organization as SMA Europe, who is called ALAME, who cover most of the country, patient organization in most of the country in Latin America. So this alliance can support you. We do also a very important work on awareness at European level, even if a newborn screening is not relevant, but we try to do some awareness. And we are working now also on what happened after a positive screening to support the clinician, to support the patient organization, to have a very good and fine and kind access to this family, because this family of just a baby for 5 days, and you announce they have a very severe disease. So you have to be careful and to give them the right information in the right time. So it's very important for us to have this access on newborn screening. And then, of course, we need to have very good interaction and communication and to outreach more or less everywhere. So if you go, we have a website. So we have rebranded it, but it's very important. We have a lot of interaction between us, our General Assembly. Next one will be in April in Prague. We have all the patients, but also sometimes some key people from pharma company or for the scientific committee to come with us and exchange. Every 2 or 3 months, we have a delegate call to exchange on key activity, and it's a very nice way to work together. And we have created a very specific task force regarding adult, because you all know that there's a lot of things done for children. The pediatric hospitals are very, very kind with children in most of the country. We have access to treatment in most of the country, but for adults, it's much more challenging to do that. And it's also challenging for their social life to have access to a professional caregiver and so on. So we have this adult committee with, I think, 20 or 25 adults living with SMA, trying to support and to design how we can interact and impact on this specific population. A small board retreat, of course, to prepare all this work and to do our action plan. We are now preparing the next action plan, 2023-2024. It's very important. And we have regular workshop or webinar to train our population. Last one was about how to what is the way to access to SMA newborn screening in the different country, and how patient organization can impact the national authority, and what is the best way to interact, or not the best way, but maybe one way to interact with national authority to impact all this to newborn screening. And it's this webinar more or less every time available on our website or in the SMA Europe website. So you can have an access to all this webinar. They are free for access on our website. So just to give you the idea that all together we have one goal. What is important for me that, of course, if you are a member of SMA Europe, you know SMA Europe, but if you are a patient organization at national level who wish to ask a question for SMA, please go to SMA Europe. There's no difficulty, even if you are a member or not member. It's very important to work together to allow to all patients with SMA to have good access to treatment, good access to newborn screening, and access to care, to caregiver. So we are very happy to welcome you at SMA Europe and to give you any support you need.
Thank you.